Thank you, President and Council of the SSM, for inviting me to speak at this symposium. The star-studded symposium, I'm already starstruck. I will speak to you from here and conversation with you. Now, my dear friend Eugene started with a story. Madam Anoja started with her own story. Eugene started with this story from 1970, I think it was, Muhammad Ali versus Corrie. I go further back in history and tell you the story of Kati. Kati was introduced to me by my very dear friend Himanta Atukorala. Some of you may know Himanta. He's a brilliant rheumatologist. He works in Matara. In 1956, Dr. P.E.P. Dharaniyagala, at that time the director of the National Museum, in an excavation discovered 13 skeletons in a place called Bellambandi Palace in the Ratnapura district. These were subsequently dated, carbon dated to 12,750 years before now. That's Middle Stone Age. And those skeletons are kept to this day. Behind the National Museum, there is a smaller building, and that's named the National Museum of Natural History. And the skeletons are there. And Himanta was being the rheumatologist, he was very interested in the bones and was going through that. And he came across this 55-year-old woman's skeleton, through paleontological techniques that had been dated to a 55-year-old woman who had a severely eroded femoral condyle. So the diagnosis is this lady had severe osteoarthritis of at least one knee. So many questions arose from that. Now, this is a Middle Stone Age period, and people didn't have permanent residences. They moved from place to place. How did she walk? Did she have a wooden stick? Did somebody prepare wooden sticks for her to walk? Did she have wooden braces? Did the males carry her, able-bodied males carry her? See, she was not serving any useful purpose for that community. She could not bring home any fruits or vegetables from anywhere. She couldn't prepare food. She couldn't care for the young. She couldn't produce any more children. Like useless kind of person. But that society was very compassionate to her and looked after her well into her 50s. And by Himanta's diagnosis, the osteoarthritis would have been there at least for about 5 or 6 years, severely disabled. The question is, how would Kati have perceived the care she received? If there were indeed medical attendants in that community, how would Kati perceive the care that she received from the medical attendants or from her own community as well? Now, we do assess perceptions of patients. We ice the patient. We assess ideas, concerns, and expectations of patients. But if we really look at it very carefully, we ice patients only with regard to their perception about the illness. We never assess patients in terms of their perceptions about the care that they receive, the interaction they have with the doctors. That part has not been touched as yet. Now, even this morning, we speak a lot about empathy, compassion, all emanating in the doctor-patient interaction or relationship from doctor to patient. How should we empathize? How should we develop our compassion? Have we ever paused to wonder, what about the patient? How does the patient, if you look at it from that perspective, how does it look like? Is it only doctors who can empathize with people? Is it possible for patients to empathize with doctors? Do patients have empathetic skills which they use to scrutinize their doctor and see what is the care I am getting from him or her? Now, this is not very difficult to understand if we can actually skip out of our doctor life and think about our life as a human being. We empathize with characters that we read in books. We empathize with characters that we see in films. We empathize with characters that we hear about in songs. So empathy is a universal human quality. It is not something which is from doctor to patient. It goes a lot beyond those narrow confines. So what my proposal is, what I'm proposing to you is, the carer and the patient perception depends on the empathy that that person exercises towards the doctor. Now, I'm sure all of you know about Shehan Karunatilaka. His new book is very famous, The Seven Moons of Malia Almeida. I'm sure some of you may have read his previous book, The Chinaman. And may I quote from the very first page of, I seek your permission to read a paragraph from his first book, The Chinaman, which actually highlights this point. This is a medical encounter between a consultant and Gamini Karunasena, who is an alcoholic sports writer. He's now got cirrhosis as well. So Gamini Karunasena writes, "No one knows about this visit to Navasiri Hospital. Not Sheila, who has begun to notice my falling hair, my swollen fingers and the rings under my eyes. Not Ari. Ari is his drinking partner, the other sports writer. Ari remarked on how my hand shakes as I pour. Not even Kusuma, the servant who wakes up every other morning to clean up my acidic, blood-stained vomit." Now he describes the doctor. "The doctor is younger than my son and has a put-on smile that does not soften the blow. Mr. Karunasena, your liver is being destroyed. It will get worse. At least I have my heart. My giggle is as pathetic as my attempt at humor." He ignores and begins scribbling. "Can't you give me pills?" "I can give you pills for the nausea and the fever. I can also refer you to our alcohol counselor." The doctor tears off a chit branded by a pharmaceutical company I have not heard of. "The rest, uncle, is up to you." How much time I keep my tone even and my eyes fixed, hoping the pup won't see that the old dog is ruffled. If you stop drinking and start eating, exercising, uncle can bat on for another 10, 20 years. The things they don't teach you at school: how to love, how to die, how to stage a dramatic comeback. Now, this is a beautiful description to me of how a patient uses his empathetic skills to assess, to scrutinize the doctor. The doctor says all right things here. He hasn't said anything wrong. Medically, he is perfect. Communication, I think it's quite spot on. But something is lacking. The pup, the arrogant, the overconfident pup, and the old dog who has been ruffled. We must remember that we are under scrutiny at all times from our patients through their exercise of empathy. I will conclude my brief presentation with another story, the story of Kuppai. Now, Kuppai is a 60-year-old lady. She's from Deniaya. She's from the plantation estate Tamil community. She has been unwell and has been gone from a smaller hospital to a bigger hospital, and the doctors have made a diagnosis. She carries a diagnosis card which says she has acute leukemia. The best place in this country to treat acute leukemia is Cancer Hospital Maharagama. So they were about to transfer her to Maharagama. Then she left that hospital and came to another hospital in the same vicinity. Okay, I'll be honest, she came to the hospital that, we work in, all right. She didn't want to go to Maharagama. She has never heard of Maharagama. She doesn't know where Maharagama is. She doesn't understand, I'm sorry, I didn't put it into the correct context. She speaks only Tamil. She doesn't understand a word of Sinhala. So she doesn't understand what Maharagama is. She doesn't know where Maharagama is. And through one of our doctors, we discovered that none of her family members had ever visited Colombo also. Now here, we are trying our best to do the best for her by transferring her to Maharagama. So there was a big conversation. I wasn't the doctor, but there were other people. I just saw this. And then, of course, they were all discussing in depth, how do we get the best for this lady under her social circumstances? And the conclusion was that we will try to get our own oncologist. He may not know much about hemato-oncology, but let's get him to do the best possible for this patient. So all this conversation happened in Sinhala and English. And when indeed the doctor turned to Kuppai, she had not understood anything of what was discussed. But her face lit up, her eyes became bright, and she smiled with the doctor. Because though she didn't understand anything of what was said, within her she sensed that this group of doctors were trying their very best to do the best possible for her, to look after her in the best possible way that she saw. Ladies and gentlemen, may I propose to you that what defines you as a doctor, and perhaps what you as a human being, is how you care for the Katis and the Kopais of this world. How do we overcome this barrier and make certain that their perception of the patients and the carers' perception of the doctors is good? Like to many of the complex questions, the answers are very simple. Even to this, may I propose that you need only two things to have favorable patient and carer perception: genuineness and inner goodness. There is no escape from that, because the patients sense that, and that's what they feel. So the only way we will be able to reach out to the lesser privileged, the lesser cared for, and the vulnerable Katis and the Kuppais of this world will be through inner goodness and genuineness. Thank you, ladies and gentlemen.